So dear students, so now I am going to take a new topic, that's staff development program. So it's a broad area. So here we will see briefly what are the different components coming under the staff development program. Okay. So first we can see the definition. So in the definitions, the process of enhancing staff performance with the specific learning experiences or learning activities. So that's a simple meaning. So staff development, mainly we are concerned with the performance of the staff. Okay, that's our main task. So what is the definition? It refers to all training and education provided by an employer to improve the occupational and personal knowledge, skills, and attitude of their employees. So mainly we are concerned with the employees, those who are working in a particular organization, and improve their knowledge, skill, and attitude of their employees, those who are working there. That's the main aspect of this. Staff development includes all the training and education undertaken by an employer to improve the occupational and personal skill, knowledge, and attitude of the employees. So already I have explained that. Then, what are the needs of staff development? So we know that to update the knowledge and skills, that's our main aim. So advancement in the science and technology, that will make an importance to update the knowledge and skills of the employees. That we know that day by day the technological advancement is there, so the employees also has to be updated with the new technology. Then to meet the changing needs of the customer and role expectation, for especially for the patient care expectation or client care expectation is changing day by day, so we have to meet that. Then for high quality work, so already for all the institution they are looking for the accredited agencies and accreditation of the hospitals and all, so we have to make sure that high quality work. Then increased social change. So already I told you there is a change in the society. Then individual growth. That's for the employee. So they are also updated with the knowledge and the skills, okay, to improve their personal growth. Then what are the goals and objectives of staff development program? So first one is to assist each employee to improve the performance in her position. So for example, for getting an promotion or increment, so for that also she has to improve her performance. Assist each employee to acquire personal and professional abilities that maximize the possibility of career advancement. Okay, for the especially for the employees, they have to, we know that they have to update it with themselves for the career advancement or for the further growth of the employee. I think it's clear. Then objectives. To increase the employee productivity, our main aim of staff development program is to increase the employee productivity of the person. Then to ensure safe and effective patient care by the nurses. So thereby we can expect more quality care from the person. Then to ensure satisfactory job performance by the personnel. So they are doing better in their job situation. Then to orient the personnel to care, objectives, their job duties, personal policies, and agency regulations. Okay, so they have to be updated with their care objectives, job duties, personal policies, and agency regulations. They have to be updated with that. Then remedy to the professional malaise, that means the employees may feeling of an uneasiness and illness by revealing unsuspected opportunities for self-actualization in the present position. Maybe they are not satisfied with the present position. So to make a change in that, we have to provide them a SDP. Then to assist the employees to fulfill the requirements of registration authorities, that means for the accreditation and the licensing bodies. So maybe for example, maybe majority of the state nursing councils, they are expecting the nurses to get an accreditation, or if they have working there, or they have to undergo the staff development program. Maybe how many hours we are getting that if we are attending that any program, workshop and all, that's a credit hours we call it as. That's a compulsory for updating our requirements. Then to help the employees to cope with new practice role. എംപ്ലോയീസിന് ന്യൂ പ്രാക്ടീസ് റോളുമായിട്ട് കോപ്പപ്പ് ചെയ്യാനായിട്ട് വി ഹാവ് ടു ഹാവ് ഇറ്റ്. ദെൻ ഹെൽപ്പ് ദ എംപ്ലോയീസ് ടു close the gap between the present abilities and the scientific basis for nursing practice, that is broadening through research. So we have to make sure that their present skill with the changes in their practice. We have to make sure that what we are learning and what we are practicing. Okay, that's regarding the. So these all are the different points coming under the objectives of staff development program. So already we have mentioned that. So the goal and then objectives, you just go through that. Then we can move on to the types of staff development activities. Formal and informal group and individual training and education conducted by the healthcare agency or a local college, or maybe different modes are there. According to that, we can classify it. So this is a simple model given in one of our texts, staff development model for goal achievement of the healthcare agency, the nurses and the nursing profession. Okay, later I will give the two important models. Okay, so here they have given the healthcare agency is in the center and the nurse and nursing profession. Okay, then comes their education, experience and the socioeconomic status. Then the outer border, it's given manpower planning, employee-employer relationship, and then counseling, career planning, performance evaluation. Then the other context, in the experience context, they have given nursing practice and other real life experience of the nurses. Then education side, they have given post basic nursing education or any higher education. Okay, then continuing nursing education comes the in-service education and extramural education. We can see that later. This is a simple model of goal achievement of the healthcare agency. Okay, I think it's clear. Then we can see what are the different training, or what are the different types, we will call it as staff development activities, different types of staff development activities. That's induction training, orientation procedures, in-service education, continuing education, and other specific educational programs like supervisory training, managerial training, and leadership development or management development. Maybe some of the terms are varying. Okay, so these all are the different types of staff development program. So we can see each one. The first one is the induction training. As we all know that induction training, it's a brief standardized indoctrination to an agency's philosophy, purposes, administration, programs, policies, regulations that is given to every worker during the first 2 to 3 days of employment to foster quick identification with the agency. യൂഷ്വലി നമ്മൾ ഒരു 2 to 3 ഡേയ്സിലോട്ട് കൊടുക്കുന്നതാണ്. ദ മെയിൻ ഒബ്ജക്റ്റീവ് ഓഫ് ദിസ് ഇൻഡക്ഷൻ ട്രെയിനിങ് is to ensure new nurse employees to retain, to help in settle down quickly and happily, to its role and to identify them with institutional goals and programs. ഈ എംപ്ലോയീസിനെ ആ ഇൻസ്റ്റിറ്റ്യൂഷനകത്തേക്ക് അട്രാക്റ്റ് ചെയ്യാനും വി ആർ ഗിവിങ് ദം ആൻ ഇൻട്രൊഡക്ടറി some idea about that their roles and identify where they are suitable. So such type of information we are giving through the induction training. Then comes the orientation. I think the induction training is clear. Then orientation, it's a broad area. Maybe this question can ask like orientation program itself, plan one orientation program for intensive care unit staff nurses, like that. So what is that? It's for the new nurse employees to the organization. Orientation, they are giving training program intended to acquaint a newly joined employee with the job responsibilities of self and significant others. So it is familiarizing the employees to their new role. So that's what we are doing. We are making the employees to familiarize with the new role. That's what we are doing in the orientation. Okay. So that we know that the important different aspect of orientation. Importance of orientation: it provides essential, relevant and necessary information to a new employee to promote, transfer, or an old employee requiring refreshing of new knowledge. So we can give it for an before the promotion process also. Then helps the employee to gain confidence, which in turn leads to patient's confidence in new employee. So we know that the employees, if they are getting an orientation program, so automatically they are acquainted or adjusted with the new situations. Then lessen the time for the employee to learn about new situations related to her job setting. So it will help them to adjust with the new situations very rapidly. Then helps the new employee to develop a sense of belongingness to the institution and the nursing fraternity. പെട്ടെന്ന് അവർക്ക് അഡ്ജസ്റ്റ് ചെയ്യാൻ പറ്റും ന്യൂ സിറ്റുവേഷനുമായിട്ട്. ദെൻ ഇറ്റ് പ്രൊവൈഡ്സ് കറക്റ്റ് ഇൻഫർമേഷൻ ടു ദ എംപ്ലോയി ഇൻ റെസ്പെക്ട് ഓഫ് ദ ഓർഗനൈസേഷൻ, nursing service department, nursing unit setting and the position in which she has to work. That's very important. Through this orientation program, they are getting all the different aspect of this concern. Then help new employee in solving initial problems and adjust the new situation. We know that each employee is coming from different situations and a different learning experience. So they have to adjust with the new system or new practices, new policies of that institution. Then what we have to eliminate? We can eliminate these all problems by giving orientation program to the employees. Learning by trial and error, passing of incorrect information by old employees and peers. We can reduce as misinterpretations, mistakes and confusion can be maybe we can avoid, and apprehension of the employee. So we can avoid all this concept. Then I think it's clear. Then comes the goals. To rapidly assimilate the employee into the workforce. So we can make them to very rapidly adjust with the work situation. Then to ensure that the worker know their work before allowing her or him to the work. So they are familiarized with what type of work they are doing, they are going to perform. Okay, in the surgical, medical or any specialty area or whatever it is. Then the content for each worker's orientation should be determined. Whether tasks include the job description and a personal skill inventory that the worker complete during the work. So a detailed description of their job details, job description they are getting. So for the employees, it's very easy for them to adjust with that. They can prepared for the work. That's another goal. So here in this slide, so you can see a schematic representation of how this orientation program to be there. Okay, how it has to be conducted. So this orientation, introduction and different aspect we are covering. We are covering the personal policies, different aspect of the organization, and then about the personnel who all are there, and then work unit where they are going to work. Then specific nursing responsibilities, that's a job description and job responsibilities. So each one you can just go through that in detail. I am not going in personal policies. They have given their all the staff welfare, remuneration, leave, holiday, medical benefit, and what are the things are there? Organization, philosophy, objectives, and what are the policies, procedures they are following there in the different areas. Then personal means who all are the workers there in the from the organization chart. Then work unit where they are going to place, and departmental layouts, policies. Then specific nursing responsibility means what is their task, job description, and what are the ethical and legal responsibilities, to whom they have to responsible, hierarchy, everything is there in the orientation program. So that you have to just go through it, then you will get familiarized with this different aspect of orientation. I think this orientation, it's clear to you. Just see the slides. Okay. Then it's very easily you can get it. Then next is the in-service education. It may be, you may be confused with what is the difference between the in-service education and staff development program. Staff development program, it's a broad term, and in-service education is a specific program coming under that. So clearly it's given here. It refers to an ongoing on-the-job instruction that is given to enhance the workers' performance in their present job. അപ്പോൾ ഒരു ഇൻസ്റ്റിറ്റ്യൂഷനകത്ത് തന്നെ കൊടുക്കുന്ന ആ ട്രെയിനിങ്ങിനാണ്, അവരുടെ ജോബിനോട് റിലേറ്റഡ് ആയിട്ട് കൊടുക്കുന്ന ട്രെയിനിങ്ങിനാണ് ഇൻ സർവീസ് എഡ്യൂക്കേഷൻ എന്ന് നമ്മൾ പറയുന്നത്. ദെൻ ഡിഫറെൻറ്റ് കോൺസെപ്റ്റ് ഓഫ് ഇൻ സർവീസ് എഡ്യൂക്കേഷൻ. ഓക്കെ, so it's a planned educational activity. It's a planned educational activity, and it's provided in a job setting, and it helps an employee to improve the performance, and it's closely identified with the services that I have already told you. It's purely related to the service where they are working or what they are doing. Okay, it's related to that area. Okay, that is the concept. Then it's a planned educational experience provided in the job setting. It is a continued program of education provided by the employing authority. I have told you the employer is giving that with the purpose of developing the competence of employee. എംപ്ലോയീസിൻ്റെ കോമ്പിറ്റൻസ് ഇമ്പ്രൂവ് ചെയ്യാൻ വേണ്ടിയിട്ട് ആണ് മെയിനായിട്ട് നമ്മൾ ഇൻ സർവീസ് എഡ്യൂക്കേഷൻ കൊടുക്കുന്നത്. ഫോർ എക്സാമ്പിൾ, in our hospital, if you are planning to reopen a neurosurgical ICU, so if the staff nurses, those who are working there, they have to get familiarized with the different aspect of neuro ICU. So usually what the hospital organization they are doing, they are sending some staff nurses to other institution for getting, one example I am giving, for getting some training on that, how to take care of a ICU patient, especially the neurosurgical patient. So they are getting familiarized with and they are adjusted with that situation, and then they can come back. Then it is designed to keep the employees' job knowledge and the skills up to date in pace with the current job demand. Pace എന്ന് പറഞ്ഞാൽ go along with that. അപ്പോൾ ഈ എംപ്ലോയിയുടെ നോളജും സ്കില്ലും അവരുടെ ജോബ് എന്ത് ഡിമാൻഡ് ചെയ്യുന്നോ അതനുസരിച്ച് അപ്ഡേറ്റ് ചെയ്യാൻ പറ്റും. Generally, in-service education are designed to inform employees about new patient care procedures that I have already told you, new diagnostic or treatment techniques, proper care and operation of equipments, any change in the function of agency personnel and new agency services. അവരുടെ ഇൻസ്റ്റിറ്റ്യൂഷനിൽ എന്തെങ്കിലും പുതിയ കാര്യങ്ങൾ വരുമ്പോഴാണ് യൂഷ്വലി നമ്മളിങ്ങനെയുള്ള ഇൻ സർവീസ് എഡ്യൂക്കേഷൻ ഒരു ആസ്പെക്റ്റ് അങ്ങനെയാണ്. ഓക്കെ. Then it is essential to establish a centralized staff development department where a pool of instructors teach a common core of practice information to nurses. അത് മെയിൻ അപ്രോച്ചസ് നമ്മൾ പിന്നെ പറയുന്നതായിരിക്കും. സോ ദേ ഹാവ് ഗിവൺ ഡിഫറെൻറ്റ് ദ പർപ്പസ് ഓഫ് ഇൻ സർവീസ് എഡ്യൂക്കേഷൻ ഈസ് ടു ഇംപ്രൂവ് ദ നഴ്സിംഗ് കെയർ ക്വാളിറ്റി. നമ്മളുടെ മെയിൻ എയിം എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ വി ഹാവ് ടു ഇംപ്രൂവ് ദ quality of the nursing care what we are providing to the patient. Then the classes should be designed to upgrade the employee. That's a simple thing, we know that. Then we can see the approaches. So main approaches to in-service education, there is centralized approach is there, and a decentralized approach is there, and a coordinated approach is there. Centralized approach means here it's controlled by the top level management. Okay. So they are identifying the needs of the employee and they are arranging all the different aspects of in-service education. Okay. They are deciding and planning. In decentralized approach, the employee also involving in the planning, implementation of the in-service education. For example, from different departments, so we can find the need of that our in-service education in that area, and we can inform them and we can arrange for that. Then they will arrange it for the in-service education. Third one is the coordinated approach. That may be a combination of this approach, decentralized and centralized approach. I think it's clear, the in-service education. So then we can move on to the continuing education. What do you mean by continuing education? It is a training that an individual undertaken after the end of basic professional education to improve the competence as a practitioner and not with a view to gain new diploma or license. Okay. So it is a planned activity and directed towards meeting the learning needs of the nurse following the basic education. Exclusive of full-time formal education ആണ്. Then extensive form ആണ്. Okay. And it include all planned learning that is intended to increase the worker knowledge or skill beyond the needs of satisfactory performance in the present position. അപ്പോൾ അവർ വർക്ക് ചെയ്യുന്ന പൊസിഷനിൽ കുറച്ചും കൂടെ അഡ്വാൻസ്ഡ് ആയിട്ട് അവർക്ക് കൊടുക്കുന്ന ആ ഒരു ട്രെയിനിങ്ങിനാണ് നമ്മൾ എന്തെന്ന് പറയുന്നത്, കണ്ടിന്യൂയിങ് എഡ്യൂക്കേഷൻ പ്രോഗ്രാം എന്ന് പറയുന്നത്. ഓക്കെ. Then the purpose is to enable a worker to excellent performance in the present job or to achieve promotion to a position with greater responsibility. അപ്പോൾ അവർ ഇപ്പോൾ വർക്ക് ചെയ്യുന്ന അവിടെ നിന്ന് അവർക്കൊരു പ്രൊമോഷന് വേണ്ടിയിട്ടോ അല്ലെങ്കിൽ അവർക്ക് കുറച്ചുകൂടെ നല്ലൊരു ജോബ് ഓപ്പർച്യൂണിറ്റി ചെയ്യാൻ വേണ്ടിയിട്ടോ ആണ് യൂഷ്വലി വി ആർ ഡൂയിങ് ഫോർ ദിസ് അണ്ടർഗോയിങ് ദ കണ്ടിന്യൂയിങ് എഡ്യൂക്കേഷൻ. Then to provide exposure to new concepts, procedural refinement, innovative product applications or acquisition of increased expertise. ഇത് ജസ്റ്റ് പറഞ്ഞതുപോലെ തന്നെയാണിത്. Then it helps the worker to maintain specialty clinical competence. ഞാൻ പറഞ്ഞല്ലോ, for if any new equipments or technology updated ഉണ്ടെങ്കിൽ so we have to have a knowledge and skill on that area. Then what are the objectives? Purposes already we have seen. Objectives to keep up to date with the rapid scientific and technological advances in nursing practice. It's clear, I think. To learn new and effective skills required for effective decision making. Okay, for taking effective decision making, we need to have this new learning. Then to prepare the nurses for professional responsibilities. If they are undergoing the in-service education, they have that feeling of they are already gaining something new. Then we can see the areas of continuing education. So we know that post-certificate programs, bachelor degree program, MSc Nursing, Master of Philosophy, PhD, post-certificate course, like different certificate courses are there now. So we can go through that one. Okay, these all are the areas of continuing education. Then what are the needs of this continuing education? That is to respond effectively to the challenges of developing wise leadership. Okay, in future, for learning or for updating themselves, or to maybe to take responsibility in, so there they need this continuing education. So then, to increase public concern for health and welfare of all people. That's simple. Then to fill knowledge gap created by technological advances, already I told you. Then a broad philosophical basis required if nurses are to contribute effectively to the solutions of society വാസ്റ്റ് പ്രോബ്ലംസ്, സൊസൈറ്റിയുടെ പ്രോബ്ലംസിന് എങ്ങനെ പുതിയ ഇന്നോവേഷൻസ് കണ്ടെത്താം എന്നുള്ളതും അനദർ ഏരിയ ഓഫ് ദിസ് കണ്ടിന്യൂയിങ് എഡ്യൂക്കേഷൻ്റെ. ഐ തിങ്ക് കണ്ടിന്യൂയിങ് എഡ്യൂക്കേഷൻ ക്ലിയർ ആണല്ലോ. ഞാൻ ഒത്തിരി ഡീറ്റെയിൽ ആയിട്ട് പോകുന്നില്ല. യു ക്യാൻ റെഫർ ദ ടെക്സ്റ്റ് ഓൾസോ. ദെൻ വി ക്യാൻ മൂവ് ഓൺ ടു ദ സ്കിൽ ട്രെയിനിങ്. ഇതെപ്പോഴും ഒരു ആൻസർ ബ്രീഫ്ലി ക്വസ്റ്റ്യൻ അല്ലെങ്കിൽ ഡിഫറൻഷ്യേറ്റ് ചെയ്യാനൊക്കെ ആയിട്ട് ചോദിക്കാറുള്ളതാണ് സ്കിൽ ട്രെയിനിങ്. ദെൻ what is skill training? It is a form of in-service program focused on giving training on specific task or procedure. ഒരു പർട്ടിക്കുലർ സ്കില്ല് ഡെവലപ്പ് ചെയ്യാൻ വേണ്ടിയിട്ട് നമ്മൾ കൊടുക്കുന്ന ആ ഒരു ട്രെയിനിങ്ങിനാണ് എന്തെന്ന് പറയുന്നത്, സ്കിൽ ട്രെയിനിങ് എന്ന് പറയുന്നത്. ഓക്കെ, ദെൻ സ്കിൽ ട്രെയിനിങ്, ഇറ്റ് ഈസ് ദ കോർണർ സ്റ്റോൺ ഓഫ് സൗണ്ട് മാനേജ്മെൻറ്റ്, ഫോർ ഇറ്റ് മേക്സ് എംപ്ലോയീസ് മോർ ഇഫക്റ്റീവ് ആൻഡ് പ്രൊഡക്റ്റീവ്. എംപ്ലോയീസ് ഒത്തിരി പ്രൊഡക്റ്റീവ് ആവും നമ്മൾ ഒരു ഫീൽഡിൽ അവർക്ക് സ്കിൽ ട്രെയിനിങ് കൊടുക്കുകയാണെങ്കിൽ. ദെൻ വാട്ട് ആർ ദ പർപ്പസസ്? ട്രെയിനിങ് ഷുഡ് ബി ബേസ്ഡ് ഓൺ നീഡ്സ് ഓഫ് ദ ഓർഗനൈസേഷൻ. ഓർഗനൈസേഷൻ്റെ നീഡ് അനുസരിച്ചാണ് നമ്മൾ ട്രെയിനിങ് കൊടുക്കുന്നത്. റെൻഡറിങ് ബെറ്റർ സർവീസ് ടു ദ പേഷ്യൻറ്റ്. ദെൻ റിഡ്യൂസിങ് ദ വേസ്റ്റേജ്, ഫില്ലിംഗ് ഹയർ പോസ്റ്റ്, ദാറ്റ് മീൻസ് ഫോർ ദ പ്രൊമോഷൻ. ദെൻ പ്രൊമോട്ടിംഗ് സേഫ്റ്റി മെഷേഴ്സ്. ദെൻ എഫിഷ്യൻറ്റ് മെത്തേഡ് ഓഫ് ഓപ്പറേഷൻ ഓഫ് ന്യൂ മെഷീൻസ്. So for these all are the skill training purposes. Then comes the method of skill training on specific job, position rotation, special project, task forces, internship training or vestibule training. These all are the methods of skill training. Vestibule training means it's a new training course. Then what are the advantages of skill training? ട്രെയിനിങ് ഇംപ്രൂവ്സ് ദ ക്വാളിറ്റി ആൻഡ് ക്വാണ്ടിറ്റി ഓഫ് ഔട്ട്പുട്ട്. നമുക്കറിയാം ഓട്ടോമാറ്റിക്കായിട്ട് നമ്മൾ സ്കിൽ ട്രെയിനിങ് കൊടുത്താൽ അത് ഇമ്പ്രൂവ് ആവും. ദെൻ ട്രെയിൻ പേഴ്സണൽ ക്യാൻ മേക്ക് ബെറ്റർ യൂസ് ഓഫ് മെറ്റീരിയൽ ആൻഡ് എക്യുപ്മെൻറ്റ്സ്. ദേ ക്യാൻ യൂസ് ഇറ്റ്. ദെൻ ട്രെയിനിങ് ഹെൽപ്സ് ടു സ്പോട്ട് പ്രൊമൈസിങ് എംപ്ലോയീസ്. എംപ്ലോയീസിന് എപ്പോഴും ഒരു ഫീലിംഗ് ഉണ്ടാവും. ദെൻ ഹെൽപ്സ് ടു ബീറ്റ് മിസ്റ്റേക്ക് ഇൻ ദ സെലക്ഷൻ പ്രോസസ്സ്. നമുക്ക് സെലക്ഷൻ പ്രോസസ്സിൽ വരാവുന്ന മിസ്റ്റേക്കുകൾ നമുക്ക് അവോയ്ഡ് ചെയ്യാൻ പറ്റും എംപ്ലോയീസിനെ. Then training creates a feeling of security among the employees that they are properly looking after by the management. Employees, they are having that for the welfare of the employees. They are getting this skill training ondengil we can demand it, or they can have the awareness about that. Okay, these all are the advantages. Then the aims: to develop specific പ്രൊഫിഷ്യൻസീസ് എന്ന് വെച്ചാൽ അതിനകത്ത് സ്കിൽഡ് ആവുക. ദെൻ ടു പെർഫോം കറക്റ്റ് മെത്തേഡ് ആൻഡ് പ്രൊസീജിയേഴ്സ് വിത്ത് അണ്ടർസ്റ്റാൻഡിങ് ഓഫ് അണ്ടർലൈയിങ് പ്രിൻസിപ്പിൾസ്. ഇനി ന്യൂ സ്കില്ല് ലേൺ ചെയ്യുമ്പം അതിൻ്റെ എല്ലാ ഡീറ്റെയിൽസും എല്ലാ ആസ്പെക്റ്റുകളും അവർക്ക് കവർ ചെയ്യാൻ പറ്റും ബൈ ഡൂയിങ് ദിസ് സ്കിൽ ട്രെയിനിങ്. ദെൻ ടു ഡെവലപ്പ് ആൻഡ് സ്കിൽ ഓൺ ദ ജോബ് ട്രെയിനിങ്. ഐഡിയൽ സിറ്റുവേഷൻസിലല്ല, ആക്ച്വൽ സിറ്റുവേഷൻസിൽ ദേ ആർ ലേണിംഗ് ദിസ് സ്കിൽ ട്രെയിനിങ്. ഓക്കെ, Then fulfilling the established standard of quality of nursing care standards. അപ്പോൾ നഴ്സിംഗ് കെയർ സ്റ്റാൻഡേർഡ്സിൻ്റെ ക്വാളിറ്റി മെയിൻറ്റെയിൻ ചെയ്യാനായിട്ട് സാധിക്കും. ദെൻ ഫോസ്റ്ററിങ് ജോബ് സാറ്റിസ്ഫാക്ഷൻ പ്രൊമോട്ട് ചെയ്യാൻ സാധിക്കും. ദെൻ റിഡക്ഷൻ ഓഫ് ഫ്രിക്ഷൻ എമംഗ് ദ ടീം മെമ്പേഴ്സ് തമ്മിലുള്ള ഫ്രിക്ഷൻ റിഡ്യൂസ് ചെയ്യാൻ പറ്റും. ദെൻ മിനിമൈസേഷൻ ഓഫ് നീഡ് ഫോർ ഡയറക്റ്റ് സൂപ്പർവിഷൻ ഓഫ് എംപ്ലോയീസ്. അവർ സ്കില്ല് ആണെങ്കിൽ നമുക്ക് എന്ത് ചെയ്യാൻ പറ്റും, ക്ലോസ് സൂപ്പർവിഷൻ അവരിൽ നിന്ന് അവോയ്ഡ് ചെയ്യാൻ പറ്റും. ഓക്കെ, സോ ദീസ് ഓൾ ആർ ദ എയിംസ്. ദെൻ വാട്ട് ആർ ദ ടൈപ്സ് ഓഫ് സ്കിൽസ് ദേ ആർ ലേണിംഗ്? Psychomotor skills, cognitive skills, teaching skills, affective skill, communication skill, and supervisory skill. So these all are the skill they are learning during the skill training. So concluding this portion here, because the remaining portions I will discuss in the next class, because it's a broad topic. If I am taking it will it may take more than 1 hour. So remaining portions of this class I will continue with the next slide presentation. Okay, so I think this class is clear to you. Any doubt you can ask me or you can clarify it. So in this class we have seen that introductory area of staff development program. So almost all the aspect of that we have discussed: needs, goals, one model, what are the types, induction training, orientation program, in-service education, approaches, continuing education, and then skill training. Then the next class we will see the managerial training, and then different models. I will explain staff development models, and then what are the functions, benefits, steps, and how to plan and organize and implement one in-service staff development program in your organization. That also I will discuss in the next slide. Okay students, we will see you on the next class. Okay, bye.